Hi, my name is Beth Barr. I'm the Country Director for CDC Zimbabwe. CDC is the Centers for Disease Control and Prevention. We are an arm of the Department of Health and Human Services under the US government. In Zimbabwe, we work primarily on HIV with some additional work on malaria and immunization. In Zimbabwe, some of the successes around HIV really have been striking. One of the things Zimbabwe has done very well on is the prevention of mother-to-child transmission, or PMTCT. In 2014, the option B+, which is a name for the test and treat approach that's used for pregnant women. So we went from starting only women whose immune systems were very compromised to starting any woman who was known to be HIV positive and pregnant on treatment, and this has dropped the transmission to children tremendously. Zimbabwe has also done an excellent job of scaling up treatment in general and is continuing to make good strides in that area. Some of the challenges that have been observed in Zimbabwe, the human resource situation is really tough. We have situations where facilities are understaffed and there's high patient volumes coming through. Other challenges include the health systems, ensuring that data moves quickly, rapidly up to where it can be used by the people who are making decisions about the programs, and ensuring that the people who are supposed to make the decisions about programs are able to use the data in a way that guides their decision making. In 2016, towards the end of 2016, we have actually had quite a significant shift in our programming. We are working at hiring and seconding PITC, which is provider-initiated testing and counseling for HIV. So we are putting people into health facilities to support the testing, because the testing is the first step for somebody to find out if they're positive or if they're negative. Everything hinges around the testing. And so that's going to be one of our major things that we need to accomplish. On the data side, we are supporting one of the implementing partners we're supporting is working on a real-time data entry through tablets at facilities. So when you go to a clinic, it's entered on, all of your information is entered straight into a web-based application. Completely confidential, but it means that your information is there so when you go to the next step in the facility or to another facility, your data is ready available for the provider to use and to make sure that you get the highest quality care. ZIMFIA is the Zimbabwe Population HIV Impact Assessment. It's very much like the ZDHS, which is the Zimbabwe Demographic and Health Survey, in that it's a population-based study. So the sample size, or the number of people included in the study, is big enough that you can draw conclusions about the entire population of the country. And ZIMFIA focuses specifically on HIV, and so what it's doing is going to give us much more information and understanding what percentage of people out there know their HIV status, have been tested, when they were last tested, are they on treatment, when did they start treatment, and are they virally suppressed? Because viral suppression, when the virus becomes undetectable in your blood, it can still hide out, it's still there, but it's suppressed enough that you're not getting sicker. And that viral suppression is very, very important to preventing transmission, ongoing transmission between people. One of CDC's core business issues is laboratory lab. And we've worked very hard in Zimbabwe to ensure that there is capacity for doing early infant diagnosis, which means taking a dry blood spot on a paper card for all babies who are 6 weeks old and HIV exposed, whose mothers are HIV infected. And that's taken a lot of coordination and collaboration with Ministry of Health, with the Department of Lab Services, and with others who are also interested in doing the same work, such as MSF. And now we're in the process of supporting very rapid scale-up of viral load testing. So where we need to know if people are virally suppressed, if they're really taking their medications and stopping the transmission of HIV, the viral load test will give us that answer. It's a very straightforward test, but it requires a lot of coordination in terms of sample transportation to the centralized labs. We have 6 super labs in country at the moment, looking to expand more. These are Ministry of Health labs that we have brought machines in, brought additional capacity, quality assurance, sample transportation networks from the health clinics up to the hospitals and up to the labs. And so that effort is ongoing. A lot of it's behind the scenes. It's the work that people don't see, but it's very critical to helping us understand just how well we're doing in Zimbabwe with getting the epidemic under control. I think something that's really important as we really move towards the 1990, which is 90-90-90 by 2020 for epidemic control by 2030. And the three 90s, the first 90 is making sure that everybody knows their status. The second 90 is making sure that 90% of those people who know their status are on treatment. And then the third 90 is making sure that 90% of the people who are on treatment are virally suppressed. So if we don't hit that first 30 of making sure that 90% of people who are infected know that they're infected, then we will never hit the other two, and we will not get a handle on this epidemic. So the importance of that testing and finding the positives cannot be overestimated or overstated. And it's not just the responsibility of the health system to provide opportunities for testing, or for community outreach partners to provide opportunities for testing, but it's the responsibility of every individual to make sure they know their status and to follow the retesting advice as it's given depending on their risk.
For these and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.